Hello everyone, this is MBS Gallery. Today we are going to see about the blood supply of the thyroid gland. Before moving to the topic, we are going to see a little bit outline about the supply. So as we know that the blood supply of the thyroid gland means it includes both arterial supply and the venous supply. So the arterial supply, here we are going to see, there are four more arteries are there, but the two main arteries which supplies the thyroid gland is superior thyroid artery and the inferior thyroid arteries. So this is our thyroid gland first, and the superior thyroid artery. The structure we are seeing here, this is superior thyroid artery, which is the first anterior branch of external carotid arteries. And then there is a structure here. This is our inferior thyroid artery, which is a branch of thyrocervical trunk. Thyrocervical trunk. This thyrocervical trunk is a direct branch of subclavian artery here. So this in turn have its own branches. So the superior thyroid artery is split into anterior branch and posterior branch. So likewise, the inferior thyroid artery has an ascending branch. This ascending branch of inferior thyroid artery forms an anastomosis with the posterior branch of superior thyroid artery. Likewise, the anterior branch of superior thyroid artery has its own anastomosis with the fellow on opposite side. And here we have to note an important clinical structure. It is here we are seeing, sorry for my inconvenience of making this nerve in a black color. So this is a nerve called external laryngeal nerve, and here this nerve is called recurrent laryngeal nerve. So this here comes in a clinical importance. So during thyroidectomy surgeries, we are going to ligate the superior thyroid artery here in order to protect the external laryngeal nerve getting damaged. Likewise, here we are going to ligate the inferior thyroid artery in order to protect the recurrent laryngeal nerve here. So this is a little about arterial supply. So these two are the main arteries, but there are two more arteries, that is thyroidema artery, which is also known as lowest thyroid artery, and accessory thyroid artery, which supplies the thyroid glands. So let us see about in a little clear in upcoming topics. So the superior thyroid artery here, as we know that it's a branch of external carotid artery and it supplies the superficial surface of the gland. You can add a little more points that the superior thyroid artery has its two branches, anterior branch and the posterior branch. The anterior branch anastomosis with the fellow and the posterior branch anastomosis with the inferior thyroid, the ascending branch of inferior thyroid artery. You can also add this point here. And then inferior thyroid artery. So it is a branch of thyrocervical trunk, as we know that. And then it enters the gland to the deep surface, and this is our superficial surface of the gland. So it supplies the parenchyma and proper glandular substances of the thyroid gland. And the next one is arteria thyroidea. So it is also called a lowest thyroid artery here. So what is the purpose of this artery present is to supply the isthmus of the gland. So we know that now isthmus. The thyroid gland is a bilobed gland, so it's connected by bilobed gland is connected by the isthmus. So that isthmus is supplied by the thyroidema arteries. So which is also known as lower thyroid artery. It is actually the branch of brachiocephalic trunk or arch of aorta. What is that? Brachiocephalic trunk or arch of aorta. Then another artery is the accessory thyroid arteries. These arteries are numerous in numbers. They arise from the esophageal and the tracheal branches. So they supply the gland to medial surface. So this is all about the blood supply, arterial supply of thyroid glands. So next let us see about the venous supply, venous drainage of the thyroid gland. So let us see about the venous drainage of the thyroid gland. So venous drainage, before going to the veins, we have to see some important structures here. This is our left subclavian vein. So then this is our left brachiocephalic vein. and this is our important structure called left internal jugular vein. So these three are most important ones, and there are four important veins which drains the thyroid glands. So this is our thyroid glands. So which four important structures which drains veins which drains the thyroid glands. First one is superior thyroid veins. This is our superior thyroid vein, and this is our middle thyroid vein, and this is our inferior thyroid vein. The superior thyroid vein, which is actually emerges at the upper pole of the gland and accompanies the superior thyroid arteries, and it drains into the internal jugular vein. That's it, left internal jugular vein. So left internal jugular veins. And in another important is second vein is middle thyroid vein, which drains the middle part, which is small and wider one, and middle of the lobe is drained by this middle thyroid vein, which drains into the left internal jugular veins. And the inferior thyroid vein, which emerges at the lower border of the isthmus, it actually drains into the left brachiocephalic vein, not into the left internal jugular veins. As we know that the left brachiocephalic vein is nearby, that so the internal thyroid vein, inferior thyroid vein, drains into the left brachiocephalic vein. And another important vein, it is called the fourth thyroid vein. We mention it as coacher. The fourth thyroid vein, which is called a coacher, which is emerges in between the middle thyroid veins and the inferior thyroid veins, and it is also drains into the left internal jugular veins. So this is all about the venous drainage. Let us see it in a little more clear by words. So the superior thyroid vein here, so it emerges from the upper pole of the gland and it drains into the internal jugular veins. This is enough actually. Middle thyroid veins, it emerges through the middle of the lateral lobe and it also drains into the internal jugular vein. The inferior thyroid vein, so it emerges through the lower border of the isthmus and it drains into the left brachiocephalic vein. So this inferior thyroid vein supplies the lower border of the isthmus, and it is the only vein which drains into the left brachiocephalic vein. All other three veins drains into the internal jugular veins. So the next one is the fourth thyroid veins, which is also called Kocher's vein. So it emerges from the lower pole of the gland and it drains into the internal jugular vein. So let us finally see about the clinical aspect of the thyroid gland. So we already know this actually. During the operation of the gland, the superior thyroid artery is actually ligated near the gland to save the external laryngeal nerve. We know that. And again, the inferior thyroid artery is ligated away from the gland to save the recurrent laryngeal nerve. This is all about the blood supply of the thyroid glands. I hope that you guys understood it very well, and subscribe and support us for more videos. Thank you.